There is a really hot topic now in the field of neurology and neuroscience, especially in dementia world, Alzheimer's world, of the availability of blood tests to diagnose or clear someone of the risk or presence of Alzheimer's disease. As many of you know, there are millions of people, many of you out there that are experiencing perhaps some memory problem, and they would really like to take advantage of a simple objective blood test that can determine if you have Alzheimer's or not. And there are many commercially available laboratories that can measure these biomarkers very readily. You can go to your physician and ask him or her for these tests. Wouldn't it be nice you just go to your doctor and say, hey, am I going to get Alzheimer's? Am I at risk for Alzheimer's? Do I currently have the onset of Alzheimer's? Let me have that blood test and it will tell you. Well, you should know several things about these blood tests. What are these tests? They're really measuring metabolites of amyloid protein and phosphorylated tau. These are proteins that aggregate. You may have heard of them. They're the p-tau 217, p-tau 181, is the amyloid beta 42/40 ratio. And they're really correlated with the development of amyloid positive PET scans. So they've done research where they image the brain using specialized agents that basically light up the protein amyloid or its derivatives, and they see how much amyloid has developed in the patient's brain, and then they correlate that with the levels of their serum amyloid or phosphorylated tau levels. Here's the problem. There are many patients who have positive biomarkers in their laboratory tests without any real signs of Alzheimer's. And so, many of you may ask, so wait, you're telling me that there are people who have very little, if any, symptoms of memory loss, and yet their blood shows these biomarkers? And the answer is yes. Another point that I should make is as we age, these biomarkers are going to be elevated in 50% of the population. So once you hit 80, 85, a lot of these biomarkers are going to be positive. Then what's the value of these biomarkers? What's the value of these serum tests? Well, it has been shown that if you don't have the biomarkers, if you don't have positive biomarkers in your blood, it is far less likely, very low likelihood, that you're going to develop or have Alzheimer's, especially if you have symptoms. Many of my colleagues, many of the neurologists out there are still stuck in, how do I explain this to patients? My advice in general is don't go out asking for these blood tests if you don't have any symptoms. If you do have symptoms, then ask your doctor to evaluate you, meaning do a memory exam either at the bedside or there are digital exams. There are tests that are standardized that can be done at the bedside to assess whether in fact you're suffering from memory loss, because a lot of us have cognitive dysfunction which may be unrelated to a disease process. It may be related to stress or sleep. Far more common. It may be related to attention deficit issues. Even mood disorders can cause memory loss. And a lot of times you see a pattern that is very consistent with a pathological state. For example, repeating questions over and over again. You just told grandma that we're going to dinner with the family, and the grandma then asks, why are we getting dressed? Where are we going? Over and over again within a span of 5 or 10 minutes. That's one of the red flags. Or for example, they're having personality changes that are out of character. They're becoming far more easily agitated, irritable, even frustrated that you're saying that you repeated the answer, but they don't remember you saying that. Those are some red flags. So is it always going to be Alzheimer's? And if you go and do these tests and they come out even semi-positive, what's it going to do? It's going to create a lot of anxiety on your part or your family's part. And then what is the definitive test then after you get these blood tests to for sure tell you if you have blood markers? Are you going to do a biopsy of your brain, which is actually the gold standard for diagnosing Alzheimer's? Are you going to do these expensive PET scans, which still are not going to give you a definitive answer? So in summary, the best sort of approach is to see your neurologist, do a complete comprehensive exam, talk to your neurologist about your history, your sleep patterns, your exact memory issues, and then the neurologist will give you a probable risk sort of stratification. What is your risk likelihood based on just the exam and the evaluation? And then do the blood test. Now, the lab tries to stratify these biomarkers into high risk, intermediate risk, or low risk. So that can also help. So just because you have these biomarkers positive in your blood is not enough. You should then ask, what are the levels and are they consistent with my symptoms? So I urge patients and clinicians to not just nilly-willy order these tests. They're not, necessarily going to give you an answer, and to consider that as we age, these biomarkers elevate without there being any signs of Alzheimer's. You really have to look at the whole patient. And there are other tests. There is what I do personally in my office. We evaluate the brain's electrical activity in a quantitative way. We do all the standardized tests. We do even digital tests of the memory that compare your brain to a database, large database of thousands of patients, age and gender match to you. And then we ask loved ones and family members what are their thoughts. And sometimes it's a simple thing such as vitamin B12 deficiency, or it may be a lack of sleep, or it may be even a brain tumor. Although rare, it can cause cognitive changes. So they need to have a really comprehensive evaluation. Just doing the blood test is not going to give you a good, accurate answer, and it may only cause severe anxiety. And I've just summarized the latest American Academy of Guidelines and many of these bodies of research that are dedicated to Alzheimer's disease, and they even don't agree with all of the things that are going on with these blood tests. Finally, again, on a personal note, my personal view, the amyloid hypothesis has a lot of holes. In fact, these new medications that remove amyloid plaque from the brain do not always correlate with really significant or marked improvements in patients' actual memory issues. So I hope that helps. I encourage you to please ask questions or place comments, and I will be posting far more videos as I try to do between patients and when time allows. And I'm hopeful that this will encourage you to ask more questions, do your own research, and talk to your physicians. And of course, let me know if you have any particular questions. See the links below and hope to see you later. Thank you.